Okay, so here we have joining us Dr. Lily. Dr. Lily is the other co-owner of Swell Wellness, and we're going to just go over a breathing assessment and how we do it. So Lily might chime in here in case there's anything I miss, but we'll just kind of walk through it as we go. So what we really want to think about here is what we talked about before. Okay, we really want to take a look at postural positioning in a variety of different positions because gravity is going to be acting this way pretty much at all times, at least here on Earth. So we're going to want to check to see their cortical ability to integrate breathing and respiration, as well as their diaphragm and abdominal wall muscles in a seated position, as well as supine or quadruped or whatever positions and vectors you feel fit for their presentation and activities and recreation habits. Um, One thing we really want to pay attention to is the position of the rib cage and the pelvis when doing this, as well as the whole spine in general. And really think back to that like zona apposition that we talked about, or the position of the diaphragm as it relates to the rib cage. And based off its position, its ability to contract in a desirable way or not contract in a desirable way. So looking at Lily here, okay, she has a nice neutral spine, okay. Lily, can you actually turn and face that way? Okay. So as we can see here, Lily has a nice neutral spine. Her rib cage is fairly parallel with her pelvis. So as we discussed before, she'll have good ability to kind of pressurize her abdominal cavity, which will really allow her to get 360-degree expansion of the entire abdominal wall. Okay. So while Lily's in this position, with permission, Lily, are you okay if I put my hands on your abdomen and torso?
Yeah.
Yep. Always check. Okay, I'm just going to place my hands here. Now, I really want to place my hands gently. I'm just observing through my hands. I do not want to impede or change any of the resting tones or tension within her body, as that's really going to skew the results I'm going to get from this assessment. So I'm just going to start from the sides and just feel for lateral expansion of the rib cage as she breathes. I'm going to work my way down, just working all the way down the pelvis. I'm feeling that lateral expansion. Okay, I'm just kind of exaggerating it with my hands here, going all the way down the pelvis. Now, when I get to the pelvis, I like to take my thumbs and place them right down here, kind of at that iliolumbar ligament. Okay, so this is going to be a spot that a lot of people are not going to be able to breathe very well in that lower or inferior posterior abdominal wall. And Lily has some really nice movement, which does make sense since we do get paid to teach people about this. Okay, now, Lily, I'm going to have you face the camera. Okay, so now, again, we've already established consent and permission for me to do so, but I'm just going to start right at the inferior portion of her rib cage and then place my other hand around the back side. And I'm just feeling for that kind of anterior and lateral expansion of these lower ribs on the anterior side. Okay, from here, I'm going to work my way down. Again, right, we don't want to just have pure belly breathing. That's not really an efficient breathing strategy, despite what someone might have told you. We're really looking for 360-degree expansion. And same as before, I'm just going to slowly work my way down, all the way down until I get to her pubic bone or her pubic symphysis. And throughout this whole process, I'm also kind of looking at Lily's thoracic cavity, her neck muscles and recruitment, as well as her jaw to see if there's any sort of like deviation in any sort of way. Remember, we don't want, as we called it, reclination, where that we're coming here with every breath. So that reclination pattern, right, is a sign of poor cortical integration of the entire kinetic chain and the whole musculoskeletal system, and is really a sign that they don't know how to really use their respiratory diaphragm optimally. Okay, so as I get down here, I'm going to have to switch my hand and use kind of my fingers like this. Okay, just letting them know where I'm going to put my hands before I put them there so we avoid any sort of awkward situations. And like I said before, we're not trying to push in at this time, we're just simply observing. Okay, now if you're working with a female, you're going to kind of skip above to like the middle rib cage. And I'm just going to kind of like make a nice sandwich with my hands and feel. Now, although we do want a lot of expansion into the abdominal cavity The ribs are going to move. We just don't want early or exclusive movement upwards into the thoracic cavity, but more so pressurizing down and then just backfilling with any sort of extra breath into the upper thoracic cavity. And here Lily's doing a great job. Now, Lily, can you give us an example of like some upper chest breathing and stuff like that? So as you can see here, watch Lily's lower ribs. They're coming up and out that way. And you can see all of this filling up top. And you can see we kind of have a caving effect or a vacuuming effect up here, kind of just superior to the clavicles. Okay, if you start to see any sort of striations in the neck, that is for sure respiratory muscular recruitment or accessory respiratory muscular recruitment, and that is less than ideal, as that really should only be saved for like athletic events or from like an evolutionary perspective when you're like running from a dinosaur or woolly mammoth or whatever picture you want to put it in your head. Okay, so now we're going to have Lily lay supine for us.
What's supine?
Supine's on their back. They know that.
I know, I'm kidding.
So here in this position, okay, we want to position the pelvis in a neutral position, which is just going to be most easily done with bent legs. Now think back to your high school physics class and lever arms, okay? As Lily would extend her leg out, that's increasing the lever arm and the tension needed in the abdominal cavity to withstand a neutral pelvis, which is just going to be harder, which is just going to be more of an advanced breathing assessment. So we're going to start with knees bent, okay? Now, same thing, arms to the side, because as the arms come overhead, same thing, the lever arm is getting longer. We're having rib flare, and we're increasing the amount of tension needed throughout the abdominal wall musculature in order to maintain a neutral rib cage position and neutral pelvis, okay? If you're confused, just open up your old high school physics book, and I guarantee they will have something about lever arms and fulcrums, and this will all make sense. Okay, so from here, I'm going to take my hands and make like a C and just kind of position them on the sides of Lily's abdomen, starting just underneath the rib cage. Okay, I'm feeling for that 360-degree expansion, noting that there is going to be more anterolateral expansion than posterolateral and posterior expansion. Okay, working my way down, I just want to make sure that we're feeling expansion all the way around. Okay, as I get to the iliac crest, I'm really not going to go farther down posterolaterally, but instead I'm going to turn my hands from like this, like that, and work my way down to the pubic symphysis. Now, if you're really comfortable with the person or the person's very comfortable with you, you can reach and try to feel the pelvic floor, but I would not suggest doing this on the average patient and definitely not without consent prior to doing so. Okay, once I do that, I'm going to kind of work my way up into the rib cage, still working my C's. Okay, skipping over any breast tissue. Lily, can you hold up your arms?
Yeah.
Okay, so now we're going to reach up into the armpits, which is going to be a really great spot to just feel for any sort of like superolateral excursion of the rib cage. Lily's got a little bit, which is not wrong or incorrect, but now one thing that we're really going to do here is we're going to want to watch the entire axial skeleton and see which spots are filling up first. So as I have my hands here, I'm noting, do I feel expansion up into my hands prior to seeing expansion into the inferior abdominal cavity? And we have a little bit, which is just a kind of thing to note, that we're going to need to work on maintaining abdominal tension to create proper rib cage positioning as this lever arm of the arm gets a little bit more drifted up top. One thing we want to do is cue Lily, can you kind of keep your ribs low? Okay, and now put my hands back, and I'm just seeing, can she maintain that position? And now there is very, very, very little expansion of the upper rib cage as the air is going down into her lower abdominal cavity, which is ideal. I'm just going to place my hands just near her neck. Again, check to make sure that you have consent to do so and that they're aware that you're going to do this. And I'm just feeling for any superior rise of the shoulders, which I don't feel any at all. All right, we're going to have Lily sit up and face that way so that you can see the back side of her body now. Okay, now when looking here, we really want to take a look at where their scapulas are, okay? As you breathe in, there should be a slight abduction and kind of anterolateral sliding of the scapulas. You want to think almost like the vertebrae should come slightly back into your hands, okay? So as she breathes, we don't want to note any sort of, can you breathe like poorly up into your shoulders? Okay, even more than that, exaggerate it so they can see. Okay, if you can see here, that spine of the scapula is going up, which is saying that she is not really using her respiratory diaphragm very well, but instead is having to recruit the thoracic inlet musculature to create that vacuum of space to bring air in. Okay, great job. Okay, now we're going to show you that kind of open scissor position. Lily, can you turn and face this way? Okay, can you kind of create an open scissor position for them? Okay, so see here, we can have this concavity here. Now, a lot of females like to stand like this because they feel like it makes them look better, and it's really important to educate them that it's really not in their best interest and will actually decrease their ability to perform athletic tasks and recruit the musculature of like the glutes and the pelvis if that is one of their goals. Okay, so as we can see here, really arch. Okay, if Lily were to load this, such as walking, running, or weight room activities or athletic activities, this is going to create a lot of compressive load down here. Now, Lily, with that nice open or not so nice open scissor position, with your arms at your side. Okay, can you breathe? And we see here, we're just getting a lot of anterior movement. And I am feeling absolutely no posterior expansion, which as we noted, she was doing before. So if this is your individual, re-go over that conversation about like the whole Coke can analogy or the hydraulic shop. Kind of just feel it out. Are they more of like a motorhead? Do they seem like they ride dirt bikes or like cars? Or do they seem like somebody who's going to favor more towards like having a beer or having a soda? And is that one going to work with them more? Okay, so here we're going to cue Lily. If you're in that open scissor position, can you take a really deep breath? Okay, can you put your hands on your ribs? Can you let all that air out with your mouth? Keep pushing, 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 pushing until there's none left. Okay, now leave your ribs there. Pull your head into my hand. Okay, now we're just checking their cortical integration, right? We want to see, is this poor breathing habit more of a pattern that they've just habitually developed? And can they actually learn a proper breathing strategy and position right out the gate? Or might there be some soft tissue restrictions that we need to address if they can't even get into this position? Okay, so now with them in this position, I'm going to have them breathe normally again. And there we have the posterior expansion. Okay, to go over this on Lily's back, so in supine, we'll have her lay back again. Okay, and from here, what you'll see if someone can't maintain a good neutral spine position is, Lily, can you arch your back like a lot of people do? Okay, you shouldn't be able to like stick your whole hand underneath there. Okay, again, we have Lily's ribs flared up, facing this way, and her pelvis facing that way. Okay, she cannot properly pressurize this container in this position. Okay, so again, we want to cue ribs down, and you can assist them by putting your hand here. Okay, so I'm going to assist Lily here by depressing her ribs, since for a lot of people, they do not really have the ability or strength at the time to kind of create proper tension through their abdominal cavity and their abdominal wall, and then still be able to breathe. It's just neurologically or cortically too much to handle at the initial onset. Okay, so now that with her ribs are depressed, I'm going to place my hand here and just feel, can she breathe? Okay? Or do we feel her fighting my hand the whole time with very little expansion down here? Another thing to note is just note their facial expressions. If they start to have this look of panic, you have a good starting place of where you're going to start with them for proper breathing patterning and retraining. Okay? Now in the next video, we'll kind of go over what to do once we've found a poor breathing habit, or even if we have a good breathing habit and we want to start challenging it so that it has the capacity and functional limitations and ability to then be integrated into normal daily movements and athletic movements as well.